Good evening and welcome to our COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Today, Presidential Task Force expresses worry over non-compliance and rising cases in Nigeria. Dr. Ameyo Stella Adadevo Draza Health Trust supports fight against COVID-19 in Nigeria, trains over 600 healthcare workers. And U.S. President to suspend immigration amid coronavirus pandemic. And even though the coronavirus SARS-CoV-2 strain has been described as the invisible enemy, the Presidential Task Force on COVID-19 in Nigeria is taking steps to win the fight against the global pandemic. The chairman of the task force and secretary to the government of the Federation again called on all Nigerians to join hands with government in this crusade.
We have observed general compliance with the restrictions. However, much more work shall be required in the creation of awareness among the people and in securing a buy-in of all stakeholders. I find it necessary to remind us all that this COVID-19 pandemic is not a joke, and it is a global pandemic. I therefore renew the appeal of the PTF to all Nigerians to view it as such and comply with all advisories and directives in the interests of humanity. I'm pleased to inform you that as part of the support to the states, the Presidential Task Force has approved the distribution plans for medical equipment and consumables available in stock to the states. The physical distribution shall commence immediately. This will be in addition to the JACMA equipment and materials already shared to the states.
For the Minister of State for Health, the frontline health workers will not be encouraged if the right information does not come from carriers of the virus. He also makes an appeal on general compliance.
The use of face masks or face barrier that covers your mouth and nose has been scientifically proven to reduce spread of respiratory infection. I therefore urge all Nigerians to practice hand and respiratory hygiene, avoid mass gathering, and put on a face mask at all times, particularly when you leave home. Let me continue to thank our health workers for the good work they are doing and the sacrifices they are making. Nigerians are grateful and say big thank you to you all. I also want all our health workers to be extra vigilant and ensure they protect themselves as they do their jobs. We shall strive as government to ensure we provide you with all the necessary personal protective equipment required to do your work. For all Nigerians, please call the NCDC number if you suspect you have any of the symptoms or you think your neighbor has the symptoms. Stay home, stay safe, and take precautions. If you must leave the house, practice physical distancing, hand and respiratory hygiene, and put on your face mask.
The Minister of Information, Mr. Lai Mohammed, on his part, expresses worry over the purchase of what he calls fake COVID-19 vaccines, says non-pharmaceutical interventions remain the effective way.
You must ignore the vaccine being hawked in Kano, which is called COVID-19 vaccine. It's yellow in color. It is not certified by anybody. Please don't patronize the hawkers. The campaign has therefore continued to focus on the need for the populace to adhere strictly to social distancing and mass gathering restrictions. Wear face masks and ensure group personal hygiene. The next phase of the public enlightenment and advocacy campaign is to develop and disseminate IEC materials on the need to avoid stigmatizing those who have contracted the virus, the need to shun fake news, and the need to reach those who are visually challenged or hearing impaired. We have already started working on this.
Figures from the Nigeria Center for Disease Control, NCDC, puts the number of confirmed COVID-19 cases in the country at 665, with 188 patients discharged, 22 deaths recorded. Here's a look at the state-by-state breakdown of the cases, showing Lagos with the highest number, followed by the FCT Abuja, 89 cases. Kano has 59, Osun 20, Oyo State has 16, Edo 15, 12 in Ogun State, Katsina 12, Kwara, Kaduna and Akwa Ibom have 9 cases each, Bauchi 7, Gombe State has 5, Delta and Ekiti 4 cases, Ondo and Borno have 3, while Enugu, Rivers, Niger, Abia and Jigawa states have 2 cases each, with Benue, Anambra, Sokoto recording 1 case each. Now, states continue to adopt different approaches to curbing the spread of COVID-19 in Ondo State. The governor, Rotimi Akeredolu, has ordered the release of 29 inmates. The inmates are set to be those who have served a portion of their sentences. The governor believes the decongestion is a step to preventing the spread of COVID-19. It's also the same for Katsina State, where more than 400 inmates awaiting trial in Katsina correctional centers have been granted bail by the state's chief judge. In Cross River State, it is an appeal where the Commissioner for Health is appealing to the federal government of Nigeria to support Cross River in the fight against the COVID-19 pandemic. At a press briefing in Calabar, Dr. Edu said the state is in dire need of a testing center so as to ensure maximum utilization of increased testing capacity. Over in Borno State, the governor, Babagana Zulum, is worried about the manner in which the index case of COVID-19 in Borno was handled. According to him, the state is now confronted with not only losing a healthcare provider, but also exposing at least 100 persons to risk of infection. According to the governor, a panel is being set up to investigate the circumstances surrounding the outbreak, saying that the 11-year burden of dealing with the Boko Haram insurgency and its impact, the coming of COVID-19, poses a challenge which he believes is surmountable. And the Bauchi state government is set to impose a partial lockdown after a staff of the World Health Organization tested positive for COVID-19. The governor decided this at a stakeholders meeting to conclude on achieving a lockdown with minimal resistance as Ramadan approaches. Well, now joining us for more on limiting the spread of the pandemic, also with what's happening in the United Kingdom, is Dr. Adora Enechukwu, General Practitioner, Registrar, Emergency Medicine, Central London. Thank you, Adora, for joining us at this time. First, tell us about London.
Hi.
Are the cases abating? We know the ONS has released sobering statistics showing the city's hardest hit.
Yeah, I mean, it's been really difficult in general. And I think that especially a week or two ago, we had a very high rate of cases and deaths, especially in London, because it's quite heavily populated. From what I'm understanding, we're getting a lot less inpatients in hospital. So if you compare to 2 weeks ago, the actual number of patients hospitalized with COVID are down about 1,000. And we are starting to see what we think is a slight slowing down in terms of deaths on a daily basis. So it's too early to say, but for now it looks somewhat promising that we might be approaching a plateau of some sort.
Now, we understand a number of countries are taking different measures to the general use of face masks for citizens. We hear the UK government is considering public use of face masks. Lagos is planning to enforce that in some other states in Nigeria, but the London mayor has called for it. We hear the NHS is worried that it would affect the number of supplies coming into healthcare workers. What's your take on it?
I mean, there's not been any official guidance with regards to the members of the public wearing masks. I know that there are issues with shortages, and we've actually had some guidance released by Public Health England, which have stated that where possible, especially, if it's not entirely necessary, we should be able to reuse certain things. So whether it is, gowns or certain masks, you're told to, sort of attempt to reuse them if you can to deal with the shortages. But as of yet, we've not had anything formal in terms of, government advice on whether or not the public should be wearing masks.
What's your observation on how Nigeria is managing the level of our strategies in managing the crisis?
I think from what I've noticed, it seems as though Nigeria is doing a lot better, I think, in terms of the amount of cases and enforcing, a lockdown. And it appears that there's, contact tracing and things like that, which I think are really important. I think even in the UK, there was a suggestion about contact tracing earlier on, but obviously you have to have less cases. So I think that is one thing that Nigeria is doing. And I think the UK have mentioned that, when things start to slow down, we'll go back to contact tracing to prevent a second peak. So I think that is a really good example. And obviously closing things down and limiting people's movement is really the most important thing to stay safe.
Of experts and also those managing the crisis here are calling for a number more testing to get more cases. We have certain active case searches taking place in some states, but some have also said that perhaps it's time we use the rapid response test kits. What are your thoughts on that?
I mean, in terms of testing, definitely here we have the rapid response kits, and they are effective. There was some talk of antibody testing and things, which doesn't seem to have been done very much. I think the issue that we were dealing with in the UK is that the results are not very specific, meaning that if you do have a negative test, it does not entirely mean that you do not have COVID-19. And I think the issue with those tests, they are helpful, but they're not really up there in terms of their specificity, which is, I think, an issue that we're struggling with here as well. And it might be an issue that would be present in Nigeria too.
All right, finally, do you think we will ever shake hands again? I mean, when you extend your hand, someone says you're extending a bioweapon as it is. It appears the virus has transformed the way we communicate, hasn't it?
Absolutely. I think that these changes we're going to have elements of it that I think will be permanent. I think if you look at the Middle East and Asia during the SARS and the MERS outbreak, it seems to have changed general life, and I think that will definitely be the case all over the world after this. I think it was unprecedented, and it will definitely change how we approach just general safety. And I think social distancing will be something that we should probably be looking at, I think, for the next few years.
All right, Dr. Adora Enechukwu, thank you for joining us on the program.
Thank you for having me.
Still to come on our COVID-19 updates, does the name Adadevo ring a bell? We'll tell you what the Health Trust is doing on the need for infection control and prevention in Nigeria, amongst others. Join us again.